This is going to be the appendicular portion for test 1. Starting with the scapula, we'll have to orientate it correctly so that this is medial, this is lateral. So medial border, lateral angle, superior angle, inferior angle. This is the spine, the suprascapular notch. This will be supraspinous fossa, infraspinous fossa, where the infraspinatus muscle goes, the acromion process, and the coronoid process. And yeah, I think I got the inferior superior ankle. Glenoid fossa is your socket. Okay? Moving on to clavicle. You'll have the sternal end and the acromial end. That's orientated correctly here. Moving on to the humerus. I'll orientate this correctly. Good. Olecranon fossa is always in posterior. Head goes medial. So now, here, lateral is the larger greater tubercle. Okay, so that's greater tubercle. Anterior is the lesser tubercle. In between them is the intertubercular groove. Moving down to this rough portion here, named for the muscle, deltoid tuberosity. Okay, continuing down, here the named condyles, this is named for the head of the radius on the thumb side, the capitulum, the other side is the trochlea, medial and lateral epicondyles will be there, and small depression in the front, coronoid fossa, and this is going to be olecranon fossa. That should be the humerus. Okay, good. Move on to the radius. Radial head, perfectly round, spins in that capitulum. The bump is radial tuberosity. I'm going to move down. Sharp pointy thing is always styloid process. And then over here on this other side, this is the ulnar notch of the radius. Okay? So let's go to the ulna. We're right here. Right inside the actual joint or articular part is the trochlear notch. The large tip of your elbow here is the olecranon process, and then the coronoid process that goes in the coronoid fossa, the humerus. Right here for the head of the radius, this is the radial notch of the ulna, and then distally, the sharp pointy thing once again, styloid process. Okay. Getting into the hand model. This grouping of bones is referred to the carpals. 1, 2, 3, 4, and 5 metacarpals. So this is first metacarpal, second metacarpal, and so on. Then we have all of the phalanges. Proximal, middle, and distal second phalanges, because the thumb is always number 1, 2, 3, 4, and 5. So this would be third distal, fourth middle, fifth proximal, and so on. All right, moving on to the femur. Okay, head and neck should be very simple. Greater trochanter is here. Posterior, we've got lesser trochanter, and then in between the two trochanters is this small bump here, gluteal tuberosity. I'm going to move down. This is the medial side, so this will be medial condyle, lateral condyle, medial and lateral epicondyles, intercondylar fossa in between the two, and that should be it for the femur. Okay, good. Moving on to the tibia. Now the first thing I want to find, most importantly, is the medial malleolus. That's how we figure out what is medial lateral. So here's medial malleolus. So this will be medial condyle. This will be lateral condyle. Tibial tuberosity. Sharp part here, anterior margin. And I think that's it. That is it. Yeah, that's it. Fibula. You've got the head, which is a little bit blockier and flat on top, and lateral malleolus. That's all we've got here, but do practice that skill, lateral malleolus versus head. Moving on to the foot. Weight-bearing bone is the talus. Your heel is the calcaneus. Not worried about these. These are the tarsal bones. Metatarsals, 1, 2, 3, 4, and 5. Getting into phalanges, just keep in mind, the first phalange only has proximal and distal. The rest of them 2 through 5 will have proximal, middle, and distal phalanges, just like the hand. So keep that in mind. The hyoid bone is actually in your throat, protects your larynx. All that's on this is the greater horn, and lesser horn is kind of looks like a fang there. Okay. Specialty bone, patella is the kneecap, and I want to do common parts of the vertebra, even though this is axial skeleton. The round blocky portion in the anterior is the body. The spinous process is posterior. I'm orientating this correctly. Transverse processes are off to the side. Vertebral foramen is here. Intervertebral foramen is coming off to the sides where the nerve roots exit. You can abbreviate that IVF. And then lastly, superior articular processes and inferior articular processes. This is where the bones actually come together. Superior articular process, inferior articular process. And that's it.